Okay, so first of all, thank you for doing this. I appreciate it. My first question to you is tell the audience a little bit about yourself and how you started in the therapy realm.
Okay. So man, I've been doing therapy since 2019, so not super long. Um, Started doing therapy after working as a bartender for lots and lots of years, went back to school. Um, yeah, I worked at an agency for a while. I worked in the community at Child Protective Services and moved into private practice. Um, yeah, I just have a passion for helping people find some contentment. So I think it just kind of, my path just drove me this way.
Mm-hmm. Was it like growing up, was it some sort of a passion for you or what or did you kind of work along the way to like getting to where you are now?
Growing up, my mom told me that I said I would never want to be a therapist. I actually said those words when I was, I don't know, 9 or 10. So it was definitely not something I thought I would end up doing, but I knew that I wanted to help people in some capacity. Um, and yeah, doing individual therapy was actually not in my plan at all. I wanted to be a psychologist and do research and all these like big things, more meso work. Um, but once I started doing this work, it was, I don't know, it just something clicked and it feels really rewarding.
Mm-hmm. Yeah, so you immediately got hooked to it.
I did.
Yeah, yeah.
Yeah.
Mm-hmm. So my next question is, tell me a little bit about the work that you do. What sorts of things do you do in the therapy realm now?
So now that I'm in private practice, it's really cool because I get to decide what I do. So I get to really just work with what I feel passionate about. So the type of therapy that I do is EMDR, which is eye movement desensitization reprocessing. And I love EMDR. I'm obsessed with it. You make progress really, really fast. And I've stumbled upon working with people that struggle with chronic health and chronic pain. And that was also not something I had planned. I struggle with some chronic pain, and I just kept getting people with similar issues, and then word of mouth kept growing. And so EMDR works with trauma and other things too, not just trauma, but that's what it's really known for is reprocessing past trauma in order to eliminate symptoms. And EMDR and chronic pain and chronic health are a perfect fit because usually, if there's chronic pain and chronic health, there is some sort of trauma. I usually find a lot of childhood trauma is associated when we have chronic pain and chronic health issues. But even if there's no trauma, there's usually some sort of medical trauma that occurs when we have ongoing interactions with the medical field, especially if it's something that no one can see. If there's internal stuff happening that is hard to explain, there's usually some trauma around that. So that's the population that I work with. And I work with other folks as well, but usually the chronic pain, chronic health is what I focus on.
Yeah. So, because that was my like next question, like what sorts of methods or approaches do you use in your current practice?
Yeah, yeah. So EMDR is my main focus. Um, and it's different. It's not talk therapy. So we're really digging into past experiences. Our past comes out in our current symptoms and our current day to day. So if we have things that have happened to us that we haven't reprocessed or haven't moved through in a healthy way, then it shows up with symptoms. So sometimes it'll show up with pain symptoms or health symptoms on our body. Our nervous system is dysregulated, which can impact the body. But a lot of times it'll show up for people with like anxiety or depression, or they'll get really irritated about things. Usually it'll show up in our relationships, how we're interacting with other people. And if those things aren't going smooth, then it's good to look at past experiences and reprocess that. So EMDR is a very focused treatment. So you're coming to session to reprocess past things, which can feel kind of nice because you know exactly what you're doing and you're making progress really quickly. It's hard work, but yeah, the fast progress is the best.
Mm-hmm. So like when people go in and like go in, come to your sessions and like because you talk a lot about like trying to get the past trauma from people. So like what have you been able to sort of notice when people walk into your private practice and talk about their past experiences? What sorts of common themes have you sort of noticed?
Yeah, I think well, there's so many things, but I think the biggest thing that I like people to know is that usually the themes that I see isn't necessarily single event trauma. Usually the themes that I see in people's lives are attachment trauma or things that have happened in childhood that shaped the way they see the world. And those are the things that I'm most interested in helping people because sometimes things will happen let's say we had really great parents, but they worked a lot, so they weren't home as often. And so maybe some of our emotional needs weren't met. And the child will think that, well, no one's gonna have time for me. I'm not important enough to make time for, even though the parent, of course, loves the child, but it's this negative belief. And then they carry that into adulthood, and that will impact some of their friendships or will impact them and their partner because the same pattern will come up. Well, you don't have time for me, or you don't make time for me, when maybe that's not actually what's occurring. And so it's this negative belief that we carry through. And so so as I get to know the client, you kind of get a sense of what is their what is their view of the world and how are they moving through the world? What belief systems do they have? What's adaptive? What's helping them in a good way, or what's maladaptive? What's not serving them anymore? Maybe as a child, that belief helped them survive that time period, but it's not helpful anymore. So we want to go back and reprocess. That's not necessarily trauma, but we'd reprocess the parent not being home, and then that would clear out that belief and move it into an adaptive way of thinking.
Mm-hmm. My next question to that end is, how do you sort of get people to look at a forward-thinking sort of vision? You know what I mean? Because you talk a lot about like people trying to relive past trauma. So how do you sort of take that into a forward-thinking approach into something more positive and more sort of that they can sort of believe in themselves as opposed to this bogged down sort of approach of like everything's not going my way,
Yeah,
people aren't listening to me, da 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 da.
yeah. That's a really tricky question. Sometimes, honestly, what I usually do with people is hope that they trust me enough and say, let's just process a couple of memories so that they can see what it feels like. Because going like let's take that example of parent going to work and leaving the child at home a lot. That maybe would take 2 or 3 sessions, and 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 then you would notice so many current things are different. They're like, oh, I'm not fighting as much with my partner anymore, or I just feel calm, or I feel a little bit more confident, like at work. I'm able to have a hard conversation with my boss. Like some of these things start to shift, and it's a great way for me to kind of get that buy-in because it's hard sometimes for people to see how this past thing can relate to the present and that forward thinking, like you're saying, like how do I teach somebody how important this past thing was and that it's going to be good for them to go back here. And so sometimes it's like you kind of got to throw the person into the deep end. It's like, let's just start processing. Let's process 1 or 2 things so that they can see how it really can impact the way that they're moving through the world. And that's usually how I get people's buy-in is just we just got to go in head first and start moving through some memories.
Mm-hmm. My next question is, what impact does this kind of work, sort of the things that you do to sort of really get people to really look at their like 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 past trauma, what impact does the work that you do currently have on the greater community? You know, what sorts of things um have you learned from doing this work or hope to learn in the future?
One of my favorite things about doing individual therapy is I know, let's say you're my client, I know that the healthier you are, it's like this ripple effect. So if you're healthy, you're getting healthier and healthier. You're starting to create healthy relationships with the people around you. And that's going to impact them in a positive way, which will impact everybody that's around them. So it's like this huge ripple effect. So every person that I can that I can help start moving through life in a healthier way is going to have this greater impact. Um, so that's what I focus on because I also love working in like I love the working bigger in the community. And so I have to remind myself that the individual work is really where it's at. The community is made up of individuals. And the more people that I can help live a healthier life, the better the community is going to be.
Yeah. So because oftentimes you may have, and to my example, you may have a healthy body or whatever, you're eating healthy, blah blah blah, but sometimes you don't have a healthy mind. So that's what people
Yeah.
often don't get.
Yeah. And and coming back to working with chronic health and chronic pain, a lot of my clients, they have it's something that they're maybe going to have to manage for the rest of their life. Sometimes we will process and they will stop having pain or their health symptoms go away and they have no more pain and no more health issues in relation to their trauma. But sometimes they'll have an actual diagnosis that is going to be ongoing. And if we can calm down their nervous system, if we can process all the junk we're basically taking it out of their body and moving all the negative out, then they're able to take care of themselves. So they're able to engage in the healthy activities, the healthy eating, the healthy, exercising or whatever it is that they need to do to take care of their bodies. So it's this full circle of mind and body.
Mm-hmm. My last question is, what can people take away from this conversation? How can sort of this engaging in sort of this mindfulness approach really lead to a healthy body and a healthy mind? Because mindfulness is, I would argue, a really
Mm-hmm.
important key to
Yeah.
overall healthy well-being.
Yeah. Um, well, first of all, everyone should do EMDR. Every single person. I think it's so helpful, even if you just have small things that have happened to you. Um, and and like you said, the mindfulness is important. So really taking a look at, what's coming up in my life right now, and the part of the mindfulness is knowing yourself and knowing your body, knowing what you need, what you don't need, being able to set boundaries, all of those things, and 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 doing some therapy, doing some sort of EMDR brain work is going to give you the ability to be present and to experience that mindfulness pretty much all the time has been my experience with clients and myself doing my own EMDR. The healthier that I get, the more the mindfulness just comes naturally rather than having to do all of this hard work of trying to be mindful and trying to meditate or trying to be present. It just starts to come naturally when we do that hard work.
Hmm. What can other students, in your position, like who are wanting to study EMDR and the like, what can they sort of learn um uh, from this conversation to sort of say, hey, I want to apply it to my own practice. I
Mm-hmm.
want to do this, this, and this.
Um, well, EMDR, so can you rephrase that question?
I mean, I'm specifically talking about like for future incoming mental
Yeah,
health professionals that want to study EMDR or
yeah,
something similar to EMDR, but
yeah. So this is my perspective. I'm a little biased because I do EMDR, but I think the more that we know about the brain, the more the more the healthier our clients can get. So talk therapy has been what we've done in the past. And talk therapy is helpful. There is a place for it. But now that we know, we have all this information about the brain and how EMDR and brain spotting, brain mapping, anything that you're working with the brain, clients can make faster progress. And so as a clinician, I think there's multiple things that is helpful when you're working with the brain. Your clients are making faster progress. Your clients are the ones doing the work. With talk therapy, you're really having to connect on a deep emotional level, and which creates burnout. And so I think for clinicians to have this access to being able to watch your clients make progress in real time rather than years, your clients are making progress in months, and you're able to provide, you're basically just providing space for the client to do the work, and you're holding that space, but there's that emotional distance a little bit. So the client's doing the work, you're with them while they're doing the work. But again, it helps prevent burnout, I think. And so I really think for clinicians moving forward, that neuroscience and the science around the brain is going to be their best friend in being able to do this work long term so that you can help as many people as you can.
Mm-hmm. Yep. All right.